I'm Angie Anderson. I am the COPD Program Coordinator at Sarasota Memorial Hospital. Today we're going to have Bob Sobkowiak, who's a respiratory therapist, and Jane Rubinov, who's also a respiratory therapist. They're both with Breathe Strong, and they're going to present ways to manage breathlessness and go through the 7-step action plan.
Thank you. I want to thank Sarasota Memorial and Better Breathers for inviting Jane and I to have this opportunity to join you today. We are COPD Breathe Strong America. We're a nonprofit education organization dedicated to help to connect, engage, and empower the community of patients and providers. And to start off with, basically, the 7-step lung health action plan is a new format that we've developed this year to basically help as a framework for moving along with the journey of managing your lung health, whether it be COPD or pulmonary fibrosis or whatever life-threatening pulmonary condition you may be experiencing. And the patient is started with the information in terms of the importance of breathing. Secondly, eating right with your for your lung health. The importance of sleeping well, having an exercise plan. We integrate a 5-week walking plan, how to stay out of the hospital, finding the right healthcare team. And later on, we go into more details in terms of after the foundation of the 7-step action plan of inhaled medications, oxygen therapy options, and other aspects of managing your lung health. Jane, you want to talk a little bit about respiratory infections that we're dealing with currently?
Sure. Well, as you know, your journey with COPD can really be a challenging one. And there's going to be bumps in the road every day, just like a good old pandemic, or even things such as pneumonia, influenza, even the common cold. You know, respiratory infections don't cause COPD, but they, of course, can make those of us with COPD very, very sick, and it's hard to recover. Now, some of the things that we can do are, number one, we really need to keep up with our vaccinations. Keep them up to date. There's several of them that you should get, and we're going to cover that today. You know, stay away from large groups of people if at all possible. That social distancing thing really works. And wear a mask. I know many of you are saying, I can't wear a mask. I can't breathe when I wear a mask. But we're going to talk about some masks today that might actually be helpful for you as well. But wearing a mask really is important, especially if you have a respiratory condition to begin with. Next slide. So stay healthy this flu season. There's coronaviruses and all those other viruses out there, but who really is at risk? Well, especially for the flu, you know, and those of us who are over 60 years of age and might have some underlying medical conditions such as heart disease, chronic lung disease, asthma, diabetes, and people with weakened immune systems, maybe for undergoing cancer therapy. We are the people that are really at high risk. And what are some of the preventive measures that we can take? Well, once again, avoid close contact with people and wear a mask in public. Stay active though. Don't just isolate in the house. Get out if you can. You know, the weather's going to start getting cooler now and it'll be easier to get outside. And walk away from other people. And if you can't do that, you know, start your exercise program at home. Wash your hands frequently. Clean and disinfect common areas around your house. And follow the 7-step action plan. Also, and we're going to go through that 7-step action plan today, but you can learn more in much more detail if you go to the cdc.gov website. So, which mask is best for you? Now you can see the lady with the standard face mask. It's a surgical mask. Those work very well. Many people with COPD say, oh, I just feel like I'm suffocating every time I take a breath in. It presses up against my face and I can't breathe and it's a mess. Well, there are some other options. This actually is a hard shell type of a mask. And you can get these at Home Depot or at your hardware store. Let me bring it up here. You see it? Okay. So actually, when it's on your face, make sure you have a good seal and you press down on this little wire up here so it fits around your nose. And make sure that you have a good tight seal. When you inhale, it doesn't, move into your mouth with that negative pressure. So this is an option for you. The lady on the right, she's with broadairpro.com. If you're interested in that mask, it's much like this mask, except look at that little hose down there and that fan. Now that is a filtered fan, and you will literally feel air blowing on your face while you are being also protected with the mask. Unfortunately, they're a little expensive. They're about $60. I think you get a few masks in the box. I'm not endorsing any product today as far as masks are concerned, but that is something that you may be interested in. And also the face shield. Now this is an interesting one, the Z shield. It doesn't attach up here at your head. It actually is down here, and you can pull it down and open it if you need to and bring it back up. Now, ultimately, if you want to be super safe, wear the mask, an N95 if you could get one, and a shield to protect your eyes.
Jane, I'd like to share one thing I just saw today here. I'm speaking from Sarasota Memorial Hospital here in Sarasota, Florida. And in the hospital today, I saw another alternative to the Z shield called an Opti shield. And it's a physician on an elevator with his mask, and it's basically just reversed with instead of coming from the bottom up, it came from the top down. And it was a very slick system. And the thing, being a baseball fan and with the playoffs going on, and I'm rooting for the Tampa Bay Rays today as they encounter the 2 game in Tampa, I just wanted to share that it's like a catcher's mask that catchers used to wear, and they flip it up when they want to take it off to have the eye exposure a little bit more. But it's another version of that shield that I thought was pretty slick that I just throw in there. We call the Opti shield.
Very cool.
As far as vaccinations for stable lung health, just a quick review here. As we all know that when I put this slide together, there were 3. Now there are, I understand, 4 vaccines in the final clinical phase for 2020 availability. But basically, we are in the home stretch now, it looks like, in terms of the final clinical phase on several vaccination options, and we're looking forward to that availability in the near future. Flu vaccines. In 2020, we need to really be vigilant on this, because in the average year, only 40 to 60% get the vaccine. But in 2020, it's very important that 100% compliance, if you will, or adherence to the availability be there, because the flu vaccine reduces the risk of pneumonia. As far as pneumonia vaccines, there are 2 types in terms of the different multivalent options, but both have specific benefits. And it's important for our people with lung health disease to confer with the physician of which type is most appropriate for them. But that also is very important. The 4th point here is the whooping cough, or pertussis. The Tdap vaccine should be considered, especially if you're around children. The signs and symptoms of someone who is experiencing the whooping cough symptoms are very similar to both the COPD patient with a flare-up or the COVID patient with a flare-up, of the type of symptoms and the timing of it. So it's very important to have that discussion with your physician as well. So you do want to consult with your physician for the most appropriate vaccines for you, but especially with COPD, the influenza and pneumococcal vaccinations decrease the incidence of lower respiratory tract infections and death. Another point is the shingles vaccine. It's recommended for healthy adults 50 years and older, because 1/3 of adults in our lifetime will develop shingles if not vaccinated. And that's nothing you want to mess around with. Again, in addition to the CDC guidelines, the 2020 GOLD guidelines, or the Global Initiative for Chronic Obstructive Lung Disease guidelines, are another good source for information if you're interested in more information on these vaccinations. But what about some myths and facts about flu? It's a myth that the flu is a common cold and not a big deal. The fact is, the flu is a severe respiratory disease that can be easily spread and can lead to severe complications and even death. The number 2 myth is the flu shot gives me the flu. Well, the fact is that's not possible because it does not contain the live virus. I think one of the mistakes can be made here is that the symptoms that someone may be experiencing as side effects can be mistaken as the flu, but you cannot get the flu from the flu shot. You may have experience some side effects, but you won't get the flu. Jane, you want to talk a little bit about COPD?
Sure. So as you know, COPD makes it very difficult to get the air out of your lungs. So the problem is not so much getting the air into your lungs, but it's getting it out. And because you have some air trapping. And that's why we use pursed lip breathing. And that's something that I'm going to go over with you here in a couple of minutes. And it's going to help you get the trapped air out of your lungs and get fresh oxygenated air into your lungs. So when you inhale, the air moves from your nose and mouth into your lung structures called the alveoli. I know you probably know a lot of this already, but it's just a brief review. This is where oxygen is exchanged for the carbon dioxide. Now, COPD and pulmonary fibrosis leads to much less effective exchange of oxygen and carbon dioxide. So in chronic bronchitis, you have inflammation and excess mucus building up in the airway. So it actually becomes smaller. It's like this. I'm trying to get it on the camera. And then with the mucus and inflammation, it's smaller. But now with emphysema, you may have chronic bronchitis and emphysema. You may have both. With emphysema, the alveoli actually start breaking down and the walls between the air sacs. So the gas exchange is not happening at an optimal level. So mucus also traps air in the lungs. We've got all these things going on. Like I said, many people get chronic bronchitis and emphysema kind of going on at the same time. Let's talk about pursed lip breathing. Oh, first we're going to talk about the shortness of breath cycle. Okay, so you feel breathlessness and then you do less and your muscles weaken. And the more you get more breathlessness and then you start feeling depressed, like I don't want to do anything. I just feel too lousy. And then you start avoiding all those activities that make you feel breathless. And it's just this vicious cycle that keeps going around and around. But you know, you need to just grab yourself and say, I need to stop this cycle. I need to do something to get out of this and help yourself. Be very proactive to make yourself exercise and get involved in different activities that will make you feel better. Next slide.
So let's talk about the 7-step action plan. Number 1, we all need air and oxygen. So it's very, very important to have daily breathing exercises. We also, in step number 2, the importance of water and food, the importance of eating healthy for our lung health and other organs. Number 3, sleeping well, learning to open up our airways before we go to sleep very well, whether it be medications or devices if I have sleeping disorders. Number 4, the importance of play and exercise. It's very important to have that daily walk for good circulation. Number 5, follow your action plan, how to stay out of the hospital. Number 6, the importance of healthy relationships, finding the right healthcare team, joining a local breathing support group. Number 7, your purpose, finding your passion, setting your lung health goals. And we'll be talking about these, but these are the framework for living healthy. So where did they come from? They came from a book called The 7 Healers, a book by Dr. Scott Kennard, I would highly recommend the book. It's an easy read. Dr. Kennard is a family practice physician who focused on preventive health, and diabetes was his specialty. But I got to know Dr. Kennard at a national meeting and realized these principles apply for anyone with chronic conditions. And they're based on 7 Judeo-Christian principles that are lifelong. And number one is you can only live a few minutes without that air and oxygen. Therefore, the breathing exercises are important. You can only live a few weeks without water and food, so it's important to eat right. Number 3, after about a week with no sleep, you'll go insane, so it's important to sleep well. Number 4, without play and exercise, you'll become sick, miserable, and depressed. And you could only, after a few months to years, this too could result in death. So the importance of daily walking and staying active and getting that circulation. Excuse me, I have a little technical. There we go. Number 5, without a treatment plan, you'll become sicker. So you need to follow your action plan. Number 6, although you can live a lifetime without loving relationships, your existence will be shortened and absent of fulfillment. So you need to find the right healthcare team for your need. Number 7, likewise, you can live a lifetime without purpose, but it will be a life that is incomplete and void of meaning. So breathe strong. Okay. Step number 1, Jane.
All right. Well, as Bob had mentioned, you know, you can only live maybe a few minutes without air and oxygen. That is absolutely vital to all life. So today we're going to just talk about some of those breathing techniques I mentioned earlier. This one called pursed lip breathing, which I'm sure most all of you already know how to do. We're going to practice that for a moment. So take a slow, deep breath through your nose. And don't really hold your breath, but as you breathe out, purse your lips as you're blowing bubbles. Not like you're blowing out candles on your cake, okay? But just a good, strong flow of air. But don't breathe out too fast. Now, one of the things that you can do is actually take a Kleenex tissue. I'm going to turn myself to the side so you can see me on the camera. This is an arm's length away from my mouth. I'm going to inhale through my nose, purse my lips like I'm going to be blowing bubbles, and I'm going to show you how not to do it first. Okay, the tissue was not flapping in the breeze, although I do have a fan going on above my head. But the tissue is just a good way for you to practice at home. Okay, now this is how you would really do it. In through the nose, purse your lips and blow out. Okay, you see that tissue moving? I know it's a little hard on camera. It's really much better to do it in person with somebody, but this will do, right? So do this at least 4 or 5 times, and it can slow down your breathing and make it much easier for you to get the sensation of breathlessness to go away. So this is something you can do any place. You can be out in public, you can be in home. People won't even notice that you're doing it. And it's a great way to calm down. Next slide. Okay, belly breathing exercises. Now, I'm not going to lie on the floor right now to do belly breathing exercises, but we can do it. Let's just do it sitting in our chairs. So belly breathing helps the dome-shaped muscle under your lungs. It's a large muscle, the diaphragm, and it helps to exercise that. And so what we want to do is just sit in our chairs, put one hand on your chest and one on your belly. And I'm going to actually move so you can see me better. Okay, so I'm going to breathe in through my nose and my belly should push out like a balloon. When you inhale, your belly should go out. And then when you exhale, bring it back in with your lips pursed. We're going to try it again. belly out, balloon, lips pursed out. Okay, once again, it's not really easy on camera to do this, but Bob, could you see that?
Yes, I just want a quick comment. I've had the privilege of being involved with 4 pulmonary rehab programs in my career. And one of the early ones in Lakeland, Florida, a number of years ago, I worked with a lady named Mary. And Mary came from Ohio, and she said, Bob, I got to tell you what made the difference for our patients in Ohio is exactly what Jane just did, only actually we had a flat table where they did this. And this diaphragmatic or belly breathing made a significant difference in their patients over years. And whether it be sitting up or lying down, this really works.
So in step number 1, we're talking about breathing. Here's some breathing tips for catching your breath. So many people, when they're having shortness of breath and end up having some anxiousness, if you check yourself, you'll find that your shoulders are up here. Just drop them down. Just do a few exercises like this, up to the ears and drop them down. Let your own weight bring them down. Relax. Close your eyes and relax. So some of the things you can do when you become short of breath is just stop that activity. Whatever it is right now that you're doing, just stop. Do that pursed lip breathing technique that we just went over. And then continue with your activity, but do the pursed lip breathing while you're walking or while you're doing that activity. And if you have a pulse oximeter, you might want to just go ahead and slip it on your finger and see where your heart rate is and what your oxygen saturation is. Pretty soon you're going to have a pretty good idea of what your normal saturation is. And if it's really low, you may need some oxygen. But let's go on to the next slide. We're going to talk about a coughing exercise. Some people call it the huh cough. But just sit comfortably in the chair with your back straight and let your belly push out as you take a slow, deep breath. And you might even want to just lean on a table in front of you or your elbows on your knees. And take a slow, deep breath and hold your breath while you count 1, 2, 3, 4, and tilt up your chin and open up your lips and make a ha sound and do it 3 times. Like that. Take a breath. Repeat 2 to 4 times. So research has gone into this where that H sound actually causes a negative pressure, actually a positive pressure to get the mucus moving out. It's much more of an effective cough if you make that sound. So now if you're feeling dizzy as you do this, slow down and, just breathe more slowly. Don't take such deep breaths. But it's really important that while you cough, you make it an effective cough.
Now I get on.
Hi, Mallory.
Okay, next slide.
Ask them to unmute. Okay.
I think Mallory is here.
Right. And Mallory, if you could unmute.
Sorry, thank you.
Welcome.
Thank you.
Okay, next slide, please.
Oops. Okay. Hold on one second. Where was I?
Okay. There we go. One item that I'd like to tell you about today, which you may have seen before, this is called the breather. And
I skipped a slide. There we go. I'm sorry.
okay. We're going to talk about the pocket PEP. You see this little thing? It can fit in my hand. This is a mucus mover. Now, there are several devices out there, but this one is really cool because not only is it small, but it's very effective. And when I take a breath in and I blow out, it actually makes a vibration sound here and a feeling in my chest. I literally will feel the vibration in my chest. I'm going to do it so you can hear it, and then I'll tell you a little bit more about it. Could you hear that?
Yep.
Yep, okay. So it actually causes that vibration, and it will help to shake loose mucus that's sitting here in your airway and help you cough it out. So this is called a Pocket Pep Mucus Mover. It's created by D.R. Burton, and you can order them online. If you go to our website, COPD Breathe Strong, also we can help you get them that way. You should do the, can you just go back? Okay, so you should do this 10 times at least. If you can get up to 20, that's great. And then follow it by 2-3 coughs afterwards. Next slide. Another item I just wanted to show you today is the breather. Now, this is an inspiratory and expiratory respiratory muscle trainer. I'm going to bring it up to the camera. Can you see those little numbers on the wheel there? It's 1. Okay, I have mine on exhalation set on 1 and on inhalation set on 1. You have 1 to 5 resistance on inhalation and on exhalation. But to start out, you just start out on 1 and take a breath in, and you'll find a resistance while you inhale. And while you exhale, there will be a resistance. It actually helps to build your respiratory muscles and to strengthen them. With COPD particularly, you may want to increase your inspiratory numbers faster than your expiratory muscles, because you will have air trapping, and you want to make sure that you get the air out completely. So you will probably advance with inhalation faster than you do with exhalation. And there's a whole program, and you can go to the pnmedical.com website for a full explanation on the maintenance of this and the cleaning of it, and how to set yourself up on an exercise program. It's really wonderful. Many people actually post-COVID now are using this because there is profound muscle weakness as well. So this is a way they're getting their respiratory muscles back in shape. If you go to COPD Breathe Strong website, you can put in a coupon code, COPD Breathe Strong, and you will get a 20% off on this item. Next slide.
Also, in addition to the mucus mover and the inspiratory exercise with the breather, another option out there that is very helpful is the COPD 360 Harmonicas for Health program. And harmonicas are a great way also to strengthen your muscles, both on inspiration and expiration. You do not have to be musically talented. The program basically is a group program with an instructor manual and participant manuals, very cost-effective way. The COPD Foundation and COPD Breathe Strong, definitely either one of us would be glad to help connect you with your community to get a group started. It's a wonderful way to have fun.
Excuse me, Bob, I was just practicing.
Thank you. And I really appreciate the music. I needed that upper right now. Appreciate it. And I just want to tell you, I've been, prior to the COVID event, the last 2 years, I've been in meetings out in Denver, Colorado, that have focused on harmonica groups. And both here in Florida and in California, all around the country, patients are getting involved with this. And when you start off a workshop with the national anthem with our harmonicas by patients, it's gratifying. And just especially, you could use Zoom during this COVID time so we can go live when we get through this COVID crisis and do it live. Step 3, Jane.
All right. So as we mentioned, you can only go about a week without sleep, but then you will become very weak and probably go insane. I mean, it's really important that we get good night's sleep. So some important steps is get daily exercise and eat well, as you know, foods with magnesium and the vitamin B complex vitamins. Establish a sleeping routine that is pretty consistent. Try to go to bed and get up about the same time every day if you can. Try it. Talk to your doctor about using oxygen therapy, especially if your oxygen saturations are running low, especially during your sleep. You might need to have oximetry study done during the nighttime. You might need to open your airways with your medications before you go to bed. And it doesn't necessarily mean take your meds right at bedtime, but time it so that you will not be stimulated by them. Some of them can actually stimulate you. Get tested for sleep apnea. If you find that you're having excessive daytime sleepiness, you know, maybe you're having terrible sleep at night and you don't even really know it. Your oxygen levels may be dropping, and get tested for sleep apnea. Maybe a CPAP machine is the answer for you. So avoid smoking, of course. Avoid smoking. And if you smoke, do everything you can right now to stop smoking. And limit your intake of caffeine and alcohol. So we talked about low oxygen levels in the blood can cause sleeping problems. And COPD can be a cause of low oxygen in the blood at different times during the day and the night. And it will result in very poor quality of sleep. If you suspect, as I'd mentioned earlier, because you're having excessive sleepiness during the daytime, ask your physician or your medical folks that are taking care of you if you can get a sleep study done. Maybe you can even get it done in your home. Some people just get nighttime pulse oximetry studies done, as I'd mentioned earlier, and they'll see dips in their oxygen, and it may indicate that you need some oxygen even just during the nighttime. So Medicare and most insurances do pay for this, by the way. Next slide.
One of the things we mentioned is step 4, the importance of walking and playing exercise. I wanted to share my experience, even though I'm not a COPD patient, I am a heart patient. Recently, I became a heart patient. And I realize now, after 12 weeks of post-surgery and cardiac rehab, the importance of walking. And with COPD, you might not be able to walk as far as a heart patient, but whether it be short or long, the importance is walking, staying active, and gradually increasing. You want to keep your heart rate within your prescribed limit. You want to learn a proper breathing pattern. As Jane mentioned, you want to breathe that pattern of pursed lip breathing as you go. You want to stop and check your breathing patterns, making sure your medications or inhalers, if they're needed before you walk, work with your doctor. This conservative plan that we're going to talk about, this 5-week plan, is only a suggestion, and it may not be appropriate for everyone. You want to ask your physician for approval. But let's say that you're a newly diagnosed COPD patient. Week 1, you might want to start with 5-minute walk from the chair to the mailbox, and then rest and go back with a total 10-minute walking time. But you're checking your breathing pattern to be sure it's correct. And if it isn't not, then you want to slow down and stop and rest. But weeks 2 through 5, you're gradually increasing. The one ways from 7 to 9 to 12 to 15 for round trips of 14, 18, 24, and up to 30-minute round trips. Perhaps by yourself, with your significant other, with your pet flamingo, or if you're really courageous, with your alligator. Only kidding, okay? I just want you to know that Florida, many times you want to time this appropriately. I find that early morning, late night, or using a mall or a gym, if you happen to have a gym availability. But bottom line is, I want you to feel comfortable with whatever you need to do to be successful. Next, we want to look at in addition to your walking, other things to stay active. The Tai Chi webinars and lung health webinars that will be starting the month of October with COPD Breathe Strong are going to be available on our website. And we look forward to adding these options with both a patient with oxygen needs and expertise with Tai Chi, as well as a respiratory therapist with pulmonary rehab experience, both being available to you at least 2 times a month, maybe up to 4 times a month. We'll probably start off with a couple times a month and then work it up. But on Saturdays, they'll be available, and they'll be something that you want to keep aware of as we move into October. And the importance of telehealth rehab. Jane, you want to talk about that?
Sure. So imagine pulmonary tele-rehab at home. You know, some of you right now may be very uncomfortable going to a standalone facility or at a hospital. And you just want to, you know, commingle and work with other people. You have the opportunity to do it here with Home Rehabilitation Network. It's really great because they will work with your physician to get you set up with a program. Medicare does pay for it. If you don't have any kind of insurance, they'll actually work with you and help you set up a payment plan of $50 a month to get into it. But you will have to have technology such as, you know, a computer or a smart device so that they can interact and see you. And while they're working with you, you'll have your own personal coach working with you. So go to thehomerehabnetwork.com for more details, or even just give them a call and find out what they can offer you. Actually, I've heard lots of great comments about it, so I think maybe this is a time to take advantage of this if you're unable to get into your pulmonary rehab program where you live.
Another option is the Pulmonary Wellness Foundation has another option available called Boot Camp, and this is available to you as well. It's not a Medicare approved program, so there is no cost. It's a complimentary program of a 6-week online program. You go to Pulmonary Wellness Online Home In or visit COPD Breathe Strong website for more information. I just want to let you know that Dr. Noah Greenspan in New York has developed this wonderful program there in Manhattan. And it is a very fun, different type of program, not a traditional program, but the physical therapy and activity, along with support groups and educational videos are all available to you as well. And that's Pulmonary Wellness Foundation, and the information of both pulmonarywellness.org and COPD Foundation, or COPD Breathe Strong, we'd be glad to help assist you with more information on this option. Jane, you want to talk about I guess I'll talk about step number 5, our action. Okay, basically, what do we do if we're having a bad breathing day? Well, how can you tell, first of all, if you're having a bad breathing day? I'm glad you asked. First, I need to know, am I short of breath? Am I having difficulty completing my daily activities? Am I coughing more or wheezing more? Is my mucus thicker or discolored? Maybe I'm having trouble sleeping that Jane was referring to. I might have a low-grade fever. I might feel like I'm catching a cold. One thing about these symptoms I want to mention, though, is that recently I referred to a cardiac event that I experienced. Shortness of breath was one of the signs that I didn't recognize myself, but my family members did. My point I would like to share with you is not to make the mistake I made. I didn't listen well enough to my caregivers and my daughter and my wife saying, on the phone, Dad, you sound short of breath. And I didn't really take it as serious as I should have. So I just want to, another one is fatigue that I experienced. So everyone's a little bit different. We have different signs and symptoms, but be sensitive to what you perceive as well as those around you. So let's say you're having that bad breath. What do? Well, I will limit my activity and use pursed-lip breathing. I will take regular medications as prescribed. I will check my temperature. I will check my heart rate and oxygen level with an oximeter. I will call my doctor and get special medications like the rescue inhaler or other medications if something isn't working as effectively as it has been in the past. Or I'll call a friend and let them know my condition. I want to make sure that I will do these things if I'm having a bad day. Jane, why don't you talk about step number 6?
All right. So, you know, we can live a lifetime without loving relationships, and your existence will be shortened and absent of fulfillment. But the 7 steps recommend that you build solid relationships. And that means building relationships with your healthcare providers. Your total care team would consist of your primary care physician, nurse practitioners, physician's assistants, pharmacists, and registered dietitians, and your respiratory care team, such as pulmonologists, respiratory therapists, lung health navigators, and psychiatrists or psychologists who can really help out. So many people with COPD have problems with anxiety and depression, and make sure that you get your team built up to support you through all of your needs. You designed this family.
And one thing I just wanted to mention is be persistent, as you'll see in a couple of our stories later on. Number 7, the purpose is the key. Without purpose, life is empty, short-lived existence. The why behind everything we do, having a reason for living. Let go of being a knower of the 1% you confidently know. Embrace living as a learner of the 99% that you don't know. Mark Batterson, who's an American author and pastor and contributor to the book, The 7 Healers, wrote, "I'm not convinced that your date of death is the date carved on your tombstone. Most people die long before that. We start dying when we have nothing worth living for. And we don't really start living until we find something worth dying for. Ironically, discovering something worth dying for is worth what makes it worth living." COPD Breathe Strong honors Nick Jones, the father of Breathe Strong. Nick, at the age of 50 in 1989, experienced shortness of breath and had a heart attack number 1. In 1996, he was diagnosed with COPD and had heart attack number 2. That's when he decided to stop smoking. 1997, he enrolled in martial arts and Tai Chi. In 2001, he took that background experience of Tai Chi and arts and realized, wow, I need to go on supplemental oxygen so I can continue staying active. And then the following year, because he could stay active by using the oxygen he needed, founded the Village Airhead Support Group that met every week for 19 years and is still going on, even though Nick has passed away. And Nick's support group is growing strong to this day. For 19 years, he lived with COPD. He was a national and state champion of advocacy, research, and education. That question of depression and anxiety that we mentioned earlier, I was with Nick in Tallahassee, Florida at a meeting one time on advocacy for people with lung health. And a media person came up to Nick and said, "Weren't you depressed when you found out that you had this condition called COPD?" With a twinkle in his eye, Nick looked at that media reporter and said, "Yeah, it was pretty devastating. But I've learned in life that the best antidote for depression is going out and helping someone." And I want to just share with you that Nick took that courage and strength and said, "I'm going to not only use these 7 action steps we've talked about, but I'm going to share them with others." And his legacy is still living today. Our patient advisor, Karen Dietermeyer, is also a great example of a person who's lived the 7-step action plan. In 1991, at the age of 45, Karen experienced shortness of breath. In 92, she stopped smoking, when she was diagnosed with emphysema, she decided to stop smoking. In 2003, she was diagnosed with COPD and started on oxygen 24/7. In 2007, pulmonary rehab was a key tool to help her learning how to master the breathing techniques. A point here, she actually had persevered to find the right pulmonary rehab group. Jane mentioned earlier in step number 6 regarding the importance of healthy relationships. She needed to find the right pulmonary rehab team that would meet her needs to work with. So she persevered to find that second rehab program that worked for her. Then she became a pulmonary advocate and has joined breathing clubs. And for the past 29 years, she's lived an active life with COPD. Not only is going strong, she is on a number of national advisory and research groups, helping other patients, learning what helps them. In closing, I just want to thank you for joining us today and let you know that these guides that we've talked about are available through COPD Breathe Strong or here at Sarasota Memorial.